So looking at the bony prominences of the knee then, so we're going to start off with what we can see. So we have our patella bone. Our patella is what we call a sesamoid bone because it's engulfed in tendon. Alright, and it's obviously, we've already said it's a gliding sliding joint because it sits and runs in the femoral groove. So as we look down at our patella, we can feel the very top of it, and we can feel that on ourselves. That's our superior pole, or superior aspect of the patella. Some people call it a pole. Then underneath the bottom, you get your inferior aspect or inferior pole of your patella. Then I have my condyles, so looking at the femur, I've got my two femoral condyles, these two big bony lumps that stick on them. I've got a medial femoral condyle, because it's on the inside of the knee. And I have a lateral femoral condyle, because it's on the outside of the knee. Then, beneath that, I've got my tibial bone, and I have a medial tibial condyle as well. So the big lumpy bit that sits there, medial tibial condyle. I have a lateral tibial condyle as well, to the side there. And then we have our fibula bone, and the top of it is obviously the head of the fibula. As I spin him round to the back, or just before I spin around the back, what you can then also see is where the two bones meet, we get what we call the joint line, which is quite easy to locate on somebody. And if we're trying to work out if somebody's got a meniscus tear, which I'll talk about shortly, or a ligament injury, we might need to find that joint line to work from. As I turn him round to the back, what we've then got is, looking from it from a posterior aspect, from behind, I've got my femur coming down, I've got my two femoral condyles at the back, I have my two tibial condyles at the back as well. I've also got my head of my fibula there. What I've also got is a little bony bit here, this little bit that sticks out there is my adductor tubercle, which we spoke about last time when we were looking at muscles that come down from the hip region to there. And I've also then got, running in here, this little area here is my popliteal line. So that's really the bony anatomy that we're going to actually look at with regards to the knee. So one main bony prominence that we forgot to mention there, and we'll add it in now. Right at the front of the knee, just underneath the patella, we get a real bony bit that sticks out, and that's our tibial tuberosity. Major muscle attachment site for our quads, our quadriceps. You get a lot of kids suffer with what they call Osgood-Schlatter's disease. Osgood-Schlatter's disease is when the muscles of the quads are not growing fast enough to the bones, so it starts pulling the bone off itself, and that's where you can get a bit of an egg-shaped bone growth on that point of the knee. Osgood-Schlatter's disease.